Okay, so let's talk about one of the most critical situations a nurse can face. When a patient has a seizure, every single second counts. Your ability to act quickly, to act correctly, well, it can make all the difference. Today, we're diving into the essential steps of seizure management, a skill that every nurse absolutely needs to master for patient safety.
So, just for a second, picture the human brain. It's this incredibly complex electrical grid, right? Now, imagine a sudden, massive short circuit in that grid chaos. In that moment, what is a nurse's first, most critical move? That's exactly what we're here to figure out. Before we can manage a seizure, we really have to understand it. So, what is actually going on inside the brain during one of these, neurological storms?
At its core, a seizure is a sudden, uncontrolled blast of electrical activity in the brain. You can really think of it like a brief but super intense electrical storm that just throws the central nervous system's normal operations into total disarray. And that can affect everything from how a person moves to their level of awareness. I love this analogy because it just clicks. Think of the brain as this huge, bustling city, and its billions of neurons are the traffic lights, all perfectly synced up, keeping things moving smoothly. A seizure? That's when the whole system goes haywire. All the lights start flashing erratically, out of control, and of course, the more lights that go down, the bigger the traffic jam in the body. And just like that traffic jam, these electrical storms can be small and contained, or they can be massive. A focal seizure is like a problem at just one intersection. It's affecting a specific targeted part of the brain. A generalized seizure, on the other hand, that's like a citywide blackout. It involves both sides of the brain. Knowing the difference is absolutely key to figuring out the right way to help. So, how does a nurse even begin to figure this out? How do you unravel this neurological puzzle? Well, it all starts with some good old-fashioned detective work, gathering clues from the patient's history. This investigation really starts with listening. You're going to ask about these subtle changes that might not even seem related. Things like, have you had any new headaches, or are they getting worse? Or what about sudden clumsiness, any changes in your vision, even shifts in mood or personality? Every single answer is another piece of the puzzle, another clue to what's really going on. Sometimes the brain sends out a little warning flare right before a seizure hits. This is called an aura. It's this unique sensory experience, and it can be super specific, like smelling burnt toast when there's nothing there, seeing flashing lights, or even feeling this sudden, overwhelming wave of fear. For the patient, this can be an incredibly important heads-up. And these auras are just as unique as the people who experience them. A psychic aura, for example, might feel like a memory lane you didn't ask to go down, or a really intense feeling of déjà vu. A sensory aura, on the other hand, involves your senses. Phantom smells, weird tastes, flashing lights. For the healthcare team, documenting and understanding these auras is like having a map that points right to where the seizure is starting in the brain. So after you've gathered the patient's story, it's time to actually look inside the brain and see what's happening. We have some amazing diagnostic tools that let clinicians pinpoint the source of the electrical storm. And as a nurse, your role here is huge. You're preparing the patient, making sure they're comfortable and that they understand what's about to happen. The go-to tool for diagnosing seizures is the EEG. It basically just records the brain's electrical activity. And on an EEG, you can literally see the story unfold. You see the difference between the calm, rhythmic waves of a brain at rest and the chaotic, sharp spikes that scream seizure. Now, while an EEG is great for catching the seizure in action, a PET scan helps us find out why it's happening. It works by highlighting areas in the brain that aren't working quite right, which can reveal the underlying cause or trigger for the seizures in the first place. Okay, so diagnosis is one piece, but what do you do when the storm hits? Right then, in that moment. During an active seizure, a nurse has one and only one primary focus: keeping that patient safe. This image here really captures the essence of seizure precautions. You've got the padded side rails, the patient positioned on their side. Every single detail is designed with one goal in mind: prevent injury and keep the patient safe from harm. During a seizure, you're fighting two immediate dangers. The first is aspiration. You don't want them inhaling any fluids. By simply placing the patient on their side, you help keep that airway clear. The second danger is injury from the environment. So if they're not in bed, you guide them to the floor, you move furniture away, and you provide privacy. These simple, quick actions are truly life-saving. All right, once the immediate crisis is passed, the seizure's over, now our focus has to shift. We're moving into long-term stability, and that usually means medication and ongoing management.
And here's some really good news. For about 60% of patients, seizures can be controlled really effectively with medication. It's all about finding the right drug, or maybe the right combination of drugs, to keep those brainstorms at bay. Of course, the right medication really depends on the type of seizure. Take levetiracetam, for example. A really common side effect is somnolence, which is just a fancy word for extreme drowsiness. With clonazepam, you also watch for drowsiness, but you're also on the lookout for behavioral changes. As a nurse, you're monitoring these things so closely because too much drowsiness could lead to a fall, and behavioral changes can really impact a person's life.
Honestly, drug therapy is a delicate balancing act. The whole game is to get the best possible seizure control with the fewest possible side effects. But you know what the most important part of that balancing act is? The patient actually taking the medication. It's so critical. Missing even one dose can throw everything off and cause the treatment to fail.
A nurse's job goes way beyond just handing out pills. It's really about empowering the patient and their family with the knowledge and the tools they need to live a safe and confident life, even with a seizure disorder.
The education a nurse provides is what lets a patient take back control. This means explaining things like why it is so important to keep taking your medication, even if the seizures have stopped, or why you absolutely can't mix alcohol with these drugs. It's also about the simple things, like how getting enough rest and eating well can make a huge difference. And remember, a seizure disorder doesn't just affect the patient, it affects the whole family. That's why education is for everybody. Family members need to know what to do to keep their loved ones safe during a seizure. They need to understand things like driving restrictions, and critically, they need to know when to call 911. Connecting them with support groups can be a total game changer, too. At the end of the day, managing seizures isn't just about stopping some faulty electrical signals in the brain. It's about empowering people. It's about giving them the tools and the confidence to live their lives to the absolute fullest, safely. And that, right there, that's what nursing is all about.